I want to first ask you about the vaccination. Is this vaccine, because I have read that FDA has not approved it fully and it's still under emergency use authorization. But if you look on Health Canada website, it says it's approved. So what is your view about the vaccine and its approval?
Well, everything in this mess is upside down. Words are being used totally inappropriately. Um, this is an experimental vaccine. Everywhere it's being used internationally, it is strictly experimental. The underpinning of why you can use a vaccine with such limited safety testing, the underpinning for the use is because this entire pandemic has been called an emergency in public health, which it is not. By any definition, it is not. The vast majority of people who contract COVID, even if the diagnosis is accurate, which is a very different story, the vast majority of people, if it's no worse than the flu. And for elderly people, although they are dying in larger numbers with those with comorbidities than with the flu, um, with the flu, people in that age group and with those diseases would survive 99% of the time with the disease, whereas with COVID, those same people will survive 96% of the time with underlying diseases. So clearly, although there is a slight increase in mortality with COVID relative to the flu for elderly people with comorbidities, by no stretch of the imagination does that constitute a global emergency in public health. It is a massive distortion of the reality of how this is affecting people.
Right. So you mentioned about that it is the survival rate is 99% and majority it is not a situation of panic and emergency and the vaccines are being rolled out on emergency experimental basis. So now, doctor, can you please explain us, elaborate a bit about being experimental? Why is this vaccine experimental? Because the companies, the pharma companies, they claim that it is 95% safe and effective to prevent COVID. So what is your take about that?
Well, it's not just the vaccine companies saying it's safe. Of course, they can say it's safe because they've been protected from prosecution with blanket immunity. Of course, they're saying it's safe. They want to maximize their sales. It's not safe for a very simple reason. This is a brand new technology that's being introduced as a vaccine. Vaccine trials typically take 4 to 6 years in order to identify the complications that are not predictable. That's the entire reason we do clinical trials. In other words, you don't know what you don't know. And that's exactly the reason these trials continue for that length of time. And in particular, because of the need to check for fertility issues, which we'll talk about later, the last time I checked, pregnancy lasts 9 months. If you're conducting a trial for 6 months or less, clearly you haven't the clue about what potential effect there could be on fertility. And that's an absolutely standard thing to do before vaccines are introduced in the normal fashion.